If your go-to stretch looks something like this, and you're still getting neck, shoulder, trap, arm pain, you're doing it wrong. Follow these simple tips and stretches to finally solve that problem. All right, some common mistakes that I see all the time is with people that are having neck pain, trap, shoulder. They're often given some kind of just very basic and wrong flexion stretch, either straight down this way or off to an armpit, kind of lightly pulling to try to stretch the muscles. Now, if it was truly just a muscle problem, you strained something, that's going to be better within a week or so anyway, and you're not going to be searching YouTube right now trying to find an answer for why you're still having neck, trap, shoulder, arm pain. You're going the wrong way. Okay, one of the key things that is not taught to you very often is to set some baselines. So go ahead and sit tall, right? The first thing that's the biggest tip and the biggest trick is just getting yourself into a tall position. When you sit slouched, you often will sit with your head forward, and then you wonder when you're looking down or you're driving or on the computer, and then you wonder why this is getting worse as the day goes on. Number one thing is just sit your hips to the back so you can get nice and tall. That will help realign everything right off the bat. Once you're here, now you need to set a couple of baselines. So where is the pain? What location? Where do I feel it? What intensity, right? Maybe it's a 4 out of 10 right here. And then set some mechanics baselines of how do I move? Like, I can turn to the right. Okay, that turns it on to about a 4. Come back. Feels a little stiff, a little stuck. Go to the left. Oh, that really gets it. I'm feeling more pain that way. And then side bend. Okay, I feel a stretchiness and a pain. And then go to the left. Okay, that feels a little blocked and not easy to do. One time forward, not a bunch of times, one time, and then one time backwards. And that one really starts to get me pain there. So again, the common misconception is, well, if that hurts, I shouldn't do that. I should go this way. No. So now you set your baselines. The first one you have to go into is just called a cervical retraction. Retraction in sitting, nice and tall, head neutral. Bring the whole head and face straight back into retraction. And note what you feel. It's okay to produce a little bit of pain here. Okay, I got a 3, I come back, 4, 5, I stop. Still a 3. That's not wrong. Yellow light, keep going, more reps, more reps. So start here, cervical retraction. You don't have, I'm not forcing it, I'm not resisting it. It's not an exercise where I'm trying to strengthen any muscles. That's another real silly mistake I see. People doing like silly isometric things. That's not gonna do anything. Just go straight back into here and come back out. If you can do it without the hands, that's fine. But what I find is most people will either go down too much or they'll go back too much, and that's not right. It's the whole head straight back on a plane. So I like to just guide it with either 2 fingers or the web space of my hand. So retraction, retraction, retraction. You're not staying there. Pressure on, pressure off, okay? But if it's just neck and shoulder and arm pain or trap pain down here, we got to go here, okay? What that does is that gets the lower cervical spine where the likely problem is. Low down here, that's where you feel it in that vertical spot by the shoulder blade. And over here, you've got to get the lower cervical spine into extension. We spend way too much time of our day either down or protruded this way. Puts it in flexion. So go the opposite. Yes, it's going to be a little bit stiff. It's going to be a little bit stuck, okay? So once you get there and you can do that pretty comfortably and you're getting all the way back there, then start adding extension. So it may take you 20 reps. It may take you 200 reps. Don't worry. Just until you can get from here to all the way back. Once you can't go any further and it's not too painful, then start adding the extension and let your head roll back. Now, with the addition of the weight of your head and gravity, it's going to pinch and it's going to send that pain into the arm again. But it has to be temporary. So here, I feel it, ouch, and then come back up, okay? Goes away, no worse. Come again, okay? So work into extension, retraction, extension, all the way back. All right. Now, the next one, if you're getting it to resolve that way, stay there. If it starts to plateau, where you're getting all the way back and you're like, I feel way back there's still some there, then go with the side bending toward that side. So if it's left-sided pain, side bend toward, but you can't just side bend over to the side. You have to first slightly tuck. That's another tip. Don't just side bend over to the side. Go half tuck, then come over ear to the side, pressure on, pressure off. And again, we're not holding these in a sustained stretch. It's a repeated movement. That's another really misunderstood and I guess mistake is people are holding these stretches when they don't need to. It's not a muscle problem anyway. It's deeper. It's in the joint. It's in the disc and the soft tissues between the joints. So you don't need to sustain that. So now if you get stuck, and plateaued, then start going into it with a side bend this way. If that resolves it, great, stay there. If it's starting to give you a little bit of trouble, then go away. Maybe you go here and here, okay? And the reason we can test these is because we're always going to go back to our baselines. So let's back up a step. Let's say we had this, we started here, retraction, 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 and I stop. What's my baselines? Okay, I don't have any pain anymore in my arm, it's less. The intensity went from a 4 to a 3, and I can turn easier to the right and to the left. It feels a little smoother, okay? That's how you'll know if you're on the right track, is you have to recheck the pre-movement baselines with the post-movement baseline, and then you'll really know if you're on the right track. So start with retraction, then move to number 2, retraction extension. If you get a little bit either stuck or plateaued, it's not quite working, or even if it's starting to get a little bit worse, then go more side. So then go side bending to the side, half tuck over to the side of pain. And then the fourth one will be to go a little bit lower below it. This one often, you don't have to wait for this one for number 4. You could incorporate this right up here with this one with the retraction, is supporting the head with the hands, still tucking in, okay? You're not resisting with your hands, you're just letting it allow it to happen, and then lean back over the edge of the chair, head and upper back. This is more for that deep, like lower, or the pain that's in the middle of the shoulder blades. You need to get to that thoracic spine. So we'll start here and here, then go here, right through thoracic, try them all. It's fine to try them all, knowing that you're going to retest your baselines, okay? Rotation, side bending, where the pain is, after each one of those things. So after the retractions, check your baselines. Then go retraction extension, check your baselines. Then go side bending, check your baselines, and then thoracic, upper thoracic extension, check your baselines.